Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. I've got an exciting show for you today. We're going to talk about osteoporosis. How do you figure out if you have osteoporosis or the precursor osteopenia, low bone density? Well, the main way is with a test called a DEXA scan. We'll talk more about that in a minute. But most importantly, how can you reduce your risk of bone density? How can you reduce your risk of having a fall and fracturing your hip or your spine and suffering the severe consequences of that? Most doctors don't do that test, by the way, until you're in your 60s, late 60s usually. If you have a family history or a history of fractures, family history of osteoporosis, or a personal history, if you've broken several bones and you tell your doctor that, then they may do a DEXA scan as early as age 50. And, you should be able to ask any doctor to order that test for you, and your insurance should cover it. But if it won't, that test has actually become really, really inexpensive lately. For years, it was about $150. And I think last time I checked, it was less than $100 to get a bone mineral density scan. It's called a DEXA scan. So if you have any trouble, too much hassle getting your doctor to order it for you, or order it again, if you haven't had one done in a while, I'm happy to order that for you. But before I get back, I'm going to also talk about some patients that I've had that have reversed osteoporosis back to low bone density or osteopenia, and reversed osteopenia back to normal bone density with nutrients and not drugs. But before I start with that, I want to begin with a rant against the myopic intransigence of the medical profession's latest recommendations for osteoporosis. They're pathetic, and unfortunately, they're probably not going to change anytime soon. So here they are. These are the current recommendations that just came out, published June 30th, 2025 in the Journal of the American Medical Association. This is a document the physicians around the country and around the world look to for guidance on how to treat patients with osteoporosis. So it begins with risk factors for osteoporosis include older age, female sex, prior fractures, prior falls, low body weight, history of hip fracture in a parent, glucocorticoid use, steroids, cigarette smoking, excess alcohol consumption, and certain inflammatory conditions like inflammatory bowel disease, rheumatoid arthritis, chronic liver and kidney disease, and, of course, low bone mineral density measured by a DEXA scan, dual energy X-ray absorptometry is DEXA scan. Well, so far so good. That's all true. That's all great to keep in mind. But the next part is where the problems begin. For patients at high risk of fracture, those with a T-score of minus 2.5 or less, equivalent to a bone mass that is greater than equal to 2.5 standard deviations below that of young adults. So these tests are always kind of confusing to see because you're usually looking, if something's bad, it will be high and it'll be a positive number. But bone density scans measure the relative density compared to a healthy population. So you want your bone density to be equivalent to a healthy population, and if it is less dense, then it shows up as a minus number than the normal. And the diagnosis of osteoporosis is a T-score of minus 2.5 or less, which is actually a bigger minus number. So, for example, minus 2.7 or minus 3.0 is less than a T-score of minus 2.5. So it gets really confusing. But if you have questions about that, email me. Of course, I'd be happy to answer questions about that. But here's the problem. If someone has this high risk, a T-score of minus 2.5 or less, T-score of minus 2.5 or a bigger number with a minus in front of it, then obviously what you need to immediately do is give them bisphosphonates, anti-resorptive agents, to reduce the risk of vertebral and hip fractures. So there's no mention of the side effects of these drugs or the fact that they can actually cause bone necrosis in the jaw, cell death, and even in the hips where you're trying to prevent your risk of a fracture, or the fact that they work, their mechanism. They're called anti-resorptive agents. They work by stopping the resorption of bone. So your body's smart. It has two major types of cells to control bone growth and maintenance: osteoclasts and osteoblasts. Osteoclasts, with a C, clear old bone out so that you have room to make new bone. Osteoblasts build new bone. So obviously building new bone is usually good as long as you don't have a bone tumor. But so the assumption with taking these drugs is that clearing old bone is not important. If you have low bone density, then you shouldn't clear out any of the old bone. You should keep all the old bone you can. No, that's not a good idea. Imagine just shoving. The reason these drugs quote unquote work is because they make your tests look better. They increase your bone mineral density. They make the test numbers look better. But do they make your bones stronger? That's the question. And the answer is often, no, they don't. Because they don't increase the strength of your bones. They just increase the density of your bones. So your bones are made of a collagen matrix, which is embedded with minerals like calcium, strontium, and a few others to make them strong. So it doesn't make any sense. Imagine if you wanted to, you had a part of your house that was falling down, and instead of doing any demolition to clear out the damaged structure, like say you had a flood, and the drywall's all wet, or you've got mold or something else that's damaged, wood rot that's damaging the framing. Imagine just covering that up or injecting the wall with more something to stiffen it up, maybe just injecting a rotten wall with concrete to make it more dense. Is that going to make that wall stronger? Of course not. You need to clear out the old, damaged, weak, decayed tissue so that you can rebuild ongoingly, continually rebuild strong new bone. That's the way our bones are designed. That's the way all of our bones have both the clear out the old cells, osteoclasts, and the build new bone cells, osteoblasts. So the drugs work simply by just shutting down the osteoclasts, and that's just not good, especially when it works so much better just to take the nutrients you need, that your body needs to heal and repair bone. So these current standard recommendations that probably your doctor and everyone you know's doctor is getting continually. It hasn't really changed. It's the same recommendations that have been around for years. Patients are recommended, the Journal of the American Medical Association 2025 current recommendations for osteoporosis. Patients are recommended to follow appropriate intake of calcium, 1,000 to 1,200 milligrams, and vitamin D, 600 to 800 international units, and to pursue a regimen of muscle resistance exercises like squats and push-ups, and balance exercises like heel raises, standing on one foot. All right, let's break that down. Here's the problem with the first part, appropriate intake of calcium. If you look at the studies that all of this information is based on, it's always taking calcium carbonate. Calcium carbonate is ground up rocks and seashells. No one should take calcium carbonate. Most people do take calcium carbonate because it's cheap, and it is the calcium that's in almost 100% of one-a-day multivitamins and many, many, many of the calcium supplements that people take, even if it's a standalone calcium. So vitamin D, and if you take the better forms of plant-like forms of calcium, then the dose is half of that, 500 milligrams. So I'm going to come back to that in a bit as well. Vitamin D, 600 to 800 international units is ridiculous. The standard adult dose for vitamin D is 5,000 units a day. Some people do fine, especially as they get older, or who have any kind of chronic illness or inflammatory condition, cancer, anything that requires immune system action or decreased bone density. A lot of people take 10,000 a day and do fine. And how do we know if they're doing fine? We test the blood level of vitamin D, and the serum level of vitamin D should be between 50 and 90. Well, the standard range on most lab tests is 30, which is way too low, but up to 100. And I have patients all the time that come back and say, oh yeah, my doctor told me I should stop taking vitamin D because my vitamin D level was 40. They read the range, it says 30 to 100, and they've never seen anybody that's above 30 because most people they see don't take any vitamin D at all. And they ignore the fact that the normal range is actually up to 100. And the healthy range they don't know that the healthy range is 50 to 90. So they actually tell people to stop taking vitamin D when their level is 40, which is still too low for most people. Okay, so these guidelines also say pursue a regimen of muscle resistance exercise, squats, push-ups, great. Balance exercises, heel raises, standing on one foot, also great. But what's even more important, especially when you consider the fact that a lot of people don't want to exercise for various reasons because of inconvenience or difficulty with arthritis, pain, but most people are still walking, and just walking is an excellent exercise to maintain your bone density. And if you can tolerate it, something that's even better, a category of exercises that's even better, is anything with just even a little bit of impact. And by impact, so it doesn't mean you have to, do a jump up and down off of a stair, or there's some severe impact exercises that are not appropriate for people beyond a certain age. But something as simple as lightly jumping rope, if you have the balance to do that, or simply standing, raising your heels up and gently, not intensely, but gently dropping them down quickly, not slamming hard, but, just lifting up on your heels with both feet, holding on to something so you're not going to lose your balance depending on your age, and, basically slamming your heels down, boom, 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 pounding them down, because that impact stimulates bone growth. You hear about astronauts that are in zero gravity for even a few months, come back, and that's one of the main side effects and one of the main challenges for people that go up to the space station is they very quickly lose muscle mass and bone density, and they have equipment there to exercise to try and maintain it as best they can. But when you're not in gravity, when you're not actually bumping your bones into something every day through normal daily activities like walking, then your bones very rapidly decline. Your bones are there to provide a framework for your muscles to pull on and to support the weight of your body. And they remain strong when you're walking around in gravity, heels hitting the ground. So doing something that involves a slight amount of impact that doesn't cause any pain, doesn't aggravate arthritis, depending on your general level of fitness and your age, to a little bit of, pounding your heels on the ground, jumping, will maintain bone density. And of course, I should mention that what's really the most important thing that kind of just, most people don't want to hear about, but if you have children and grandchildren, the most important thing for preventing osteoporosis is to get adequate exercise and calcium and vitamin D and vitamin K when you're an adolescent and in your early teens and 20s. That's when you're building all of your bone. Up to about age 30, you're still building bone density, and then it starts to decline. And the more you build up in adolescence and in your 20s, the more you'll have for the rest of your life. And any cause of the decrease on that will be less likely to send you full-blown into osteoporosis. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. Today we're talking about osteoporosis, the most important nutrients to prevent osteoporosis and even reverse it are bioavailable calcium, adequate amounts of vitamin D, adequate amounts of vitamin K2, and sometimes supplemental collagen. So let's break those down. Adequate bioavailable calcium. No, this is the most important one. Everyone knows you need calcium to build bones and maintain bones, and most people take, if they're taking any supplemental calcium, when they need it. And older, you don't need to supplement calcium when you're if you're younger than 50, you probably don't need to take a calcium supplement unless you find that you're very easily falling and breaking bones in an unusual way. And, if you're barely falling, you break something, that's pretty unusual. So until you're older than 50, you usually don't need to supplement calcium more than the amount that is in a good multivitamin. And the amount that's in the problem is not necessarily the amount, and especially with calcium, it's a classic example of just the wrong form. So most calcium supplements that you buy in stores at Costco or Trader Joe's or a pharmacy, any kind of store that sells vitamins other than a health store, and even some of them there, most calcium supplements are calcium carbonate, and no one should take calcium carbonate. But nearly all of the research done on osteoporosis and calcium is done with calcium carbonate. Most doctors say, the most cost-effective form of calcium is calcium carbonate. Well, it's not cost-effective. It's cheap. It's not effective. So something that's cheap that doesn't work is not effective at anything, therefore also not cost effective. So check your labels. If your calcium supplement says calcium carbonate on it, throw it away and get something better. Of course, the best place to get any nutrient is from food. Good food sources of bioavailable calcium are leafy greens, sesame seeds, beans, and almonds, among others. And then if you're not getting enough from your diet, take a good calcium supplement with more than one form, with 3 or 4 different forms of plant-like calcium forms, like calcium hydroxyapatite, calcium bisglycinate, calcium malate. I'm going to come back to these. I'll tell you about the calcium product that I recommend and have recommended for 20 plus years to hundreds and hundreds of patients, and heard my colleagues talk about the results of recommending it to thousands and thousands of patients who have been able to reverse osteoporosis back to low bone density osteopenia, or reverse osteopenia back to normal bone density by getting adequate nutrients. So I mentioned before that you don't want to take calcium carbonate. Well, how do we know that? I mean, isn't it better than nothing? Well, not really, especially considering that other alternatives are better, which are available, which are not that expensive and work much better. But what is the problem with, where's the data? I like to base everything I speak about on this show on available research. And there is plenty of research that shows problems with calcium carbonate. For example, here's a study published in Cancer Epidemiological Biomarkers in 2003, which says intake of calcium and or dairy products has been associated with an increased risk of prostate cancer in some epidemiological studies. It goes on to say that one potential biological mechanism is that high calcium intake downregulates dihydroxyvitamin D in the bloodstream, which may increase cell proliferation in the prostate. Well, what that really means is that most people don't take enough vitamin D. If you have enough vitamin D in your system, then it's not going to downregulate the form that is involved in making it bioavailable to you when you do take it. And most people don't take enough. And in fact, pretty much all studies that properly examine the effects of vitamin D on human health show that adequate doses of vitamin D, 5,000 more units a day, achieving a serum level of 50 to 90, dramatically reduce your risk of almost every type of cancer, and especially breast, prostate, and colorectal cancer. These are among, I think the last reference I saw was 40% of cancer deaths are from breast, colorectal, and prostate cancer. And there's robust data that shows that getting adequate vitamin D in your system dramatically reduces your risk, something like 50 or 60% reduced risk of those types of cancer. And the real reason that this study showed a slight increase in the risk of prostate cancer is because it was all based on ground-up rocks and seashells, calcium carbonate. Close listeners to this show and who do their own research and pay attention to alternative health and functional medicine-related newsletters and podcasts and things like this may remember hearing that calcium can increase your risk of heart disease, of arteriosclerosis. Well, of course, calcium from food doesn't do that, but calcium carbonate does. So here's another study that was from the Journal of American College of Cardiology, published in 2021. If you just tuned in, we're talking about why most people, and most doctors especially, are so misinformed about the proper form of calcium people should be supplementing and getting into their diet to prevent and reverse osteoporosis. So American College of Cardiology 2021, we're talking about why you shouldn't take calcium carbonate. This paper talks about both taking vitamin D and calcium in combination. Vitamin D and calcium supplements are commonly used often together to optimize bone health. Multiple observational studies have linked low blood levels of vitamin D with increased cardiovascular risk. And subsequent randomized controlled trials failed to demonstrate cardiovascular benefit with vitamin D supplementation. Although vitamin D supplements do not appear to be harmful for cardiovascular health, the lack of benefit in randomized controlled trials should discourage their use for this purpose, favoring optimization of vitamin D through healthy lifestyles such as specific foods, which are not listed specifically, and modest sunlight exposure. Well, first of all, what is modest sunlight exposure? Most people have no idea what that is. And, the only way you can tell if you're getting enough vitamin D is to do the blood test. And when we test millions of people, if they're only getting it from the sun, they're usually not getting enough. So this paper goes on to describe the original 2008 Auckland calcium study, which first raised concerns that calcium supplements may increase cardiovascular risk. Again, if you read the data, how they actually did this study and all calcium studies in the medical literature, they always use calcium carbonate because it's cheap, or as they say, cost effective. Since that time, multiple studies have shown that calcium supplement users have greater risk for cardiovascular events than non-users, particularly for calcium intake in excess of 1,400 milligrams a day. Well, no one takes 1,500 milligrams a day of calcium carbonate of calcium unless they're taking calcium carbonate, because that's what their doctor tells them to do. Take 12 to 1,500 milligrams, air quotes, the only kind of calcium that's cost-effective, calcium carbonate. In the MESA study, the multi-ethnic study of atherosclerosis, calcium supplement use was associated with an increased risk for coronary artery calcification, 22% increased risk. In contrast, higher intake of dietary calcium from food sources was not associated with elevated cardiovascular risk. So it's the sad thing is that all these studies use cheap calcium that is ground up rocks and seashells. And why should we be surprised if you increase that's not well absorbed? You want any nutrient you take, you don't want it to just increase your blood levels. That's one measure. That's, the starting point. But you want it to end up in your cells. Calcium goes to your muscles and your bones primarily. So why should it be surprising if you take ground up rocks and seashells that increase your blood levels, but then are not efficiently absorbed into your muscles and bones, not efficiently absorbed into your tissues? They're just increasing your blood levels. And what would you imagine would be more likely to increase the hardening of your arteries, which is formed partly by calcium? Plaques in their arteries are formed by calcium, cholesterol, and fibrin, scar tissue. And if you already have plaques, then taking calcium carbonate will slightly increase your risk for arteriosclerosis, heart failure, stroke, as this study goes on to mention, and type 2 diabetes. Add to that list kidney stones. The main reason most doctors freak out if you're taking more than 400 units of vitamin D a day when you should be taking 5,000 is because they're convinced you're immediately going to get kidney stones. Well, it's the form of the calcium. Calcium that is not absorbed into your tissues stays too long in your bloodstream and then is filtered out by the kidneys, where it can increase your risk of a kidney stone. So even that's really, really rare, but that's why that's one of the reasons why the mainstream medical recommendations are the way they are. So the takeaway is read your labels carefully. If you're taking any supplement that has calcium carbonate in it, throw it away. And to make this task easier, if you're taking any one a day multivitamin, you can be virtually assured that it has calcium carbonate in it. The reason one-a-day multivitamins can fit the minerals, which is the most important reason to take a multivitamin, is not for the vitamins, which you can get from food, but for the minerals that most people are missing from their diet. That's the reason you want to take a multivitamin, is for the minerals. And the minerals in one-a-day multivitamins are always in forms that are very, very difficult for your body to absorb. So you can get vitamins from food relatively easily, but most people are deficient in minerals, and that's why taking a good 4-capsule-a-day multivitamin to replace those missing minerals is something that I recommend to almost everyone. Most good multivitamins are for the minerals, and they're usually 3 to 4 capsules a day. I've got some more really important material to present about osteoporosis, but it looks like we're going to run out of time here in a bit, so I promised I'd talk about some patients that I've seen, and unfortunately, we're just not going to have time to mention someone in specific and do it justice, but the general situation is they come in and we reverse the osteoporosis with safe, effective, natural alternatives like adequate calcium, vitamin D, vitamin K2, and sometimes, for some people, adequate collagen supplementation. As always, thank you for listening. Send me your questions about osteoporosis. Have a fantastic weekend.
You've been listening to Safe, Effective, Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for Safe, Effective, Natural Solutions here on 98.3 FM, The Word.